Which vitamin is known to help improve vision?
Vitamin K.
No,
What?
that's not the answer I have here.
It does, though. It's right. It is.
You do be right.
So, hey, this is Dr. Cole from Mid-Atlantic Chiropractic Center. Today we'll be playing some trivia or Jeopardy. The loser of today's game has to do either push-ups or jumping jacks. So stay tuned to find out who loses.
Question 1, round 1. Which pop star's real name is Stephanie Joanne Angelina Germanata? And this is worth 1 point.
I think it's
Angelina Jolie.
No.
You said pop star?
Yes. You can guess, but it can be worth half a point since it's not first.
Is it Lady Gaga?
Yes, it is.
Whoa, let's go!
How did you know that? I just guessed.
Second question, worth 1 point as well, is which NFL team has won the most Super Bowls?
I think I know it.
Patriots.
That's kind of right, but that's not. There's 2 teams. That is one of them, yes, but that is.
Like a half point?
I'll give it to you. I'll give it to you. If you can get the other one, I'll give you an extra half point. To answer your questions, the Patriots have 6 wins.
The Steelers is the other team.
Oh, wow.
Which 2021 movie features a group of superheroes known as the Eternals? This is worth 1 point.
Is it the Eternals?
Yes, it is. Who is the youngest player to score 10,000 points in NBA history? And this is worth 1 point.
The youngest player?
Is it Hakeem Abdul-Jabbar?
Just throw out MJ, Kobe.
Kobe Bryant.
It is not.
That was a good guess, though. Michael Jordan?
Nope. Answer LeBron James.
Wow.
LeBron was never. Oh. Kobe was a good one, though.
The last question, this is worth 2 points, is what is the most watched TV program of all time?
Simpsons.
No.
Oh, come on.
MASH?
Is it like just a show?
There is a difference between a TV program and a TV show.
The World Cup?
Nope.
Hmm.
It's the Apollo 11 moon landing. That is
Wow.
classified as a TV program.
Yeah.
It's like one event.
Well, that concludes round 1 of pop culture. Round 2 is now all health-related questions. First question is, how many calories are in 1 gram of fat? And this is worth 1 point.
36.
No.
9?
What did you say?
9?
Yes.
Let's go.
Man.
Second question,
One way.
worth 1 point as well, is what is the largest artery in the human body?
Femoral circumflex?
I feel like I'm on the right path.
I think about the abdominal aorta.
Yep, I have aorta.
Oh, aorta.
Was that along the lines of what you were saying?
No.
Third question is, what does the term VO2 max measure?
So do you want the breakdown of what VO2? It's your maximum oxygen capacity. So it's measures your aerobic exercise, your ability to handle anaerobic stress.
Yep, you got it. Next question, which is also worth 2 points, is what is the primary benefit of antioxidants in the body?
They destroy cancer cells?
So I'm gonna guess something along the lines of anti-aging.
No, I got it. Are you looking for free radicals?
The last question for this round is, what is the name of the valve that prevents food from entering the windpipe?
The valve? Is that what it
The
says?
name of the valve, yes.
I know, like the epiglottis. It's not valve.
You right? The way he's looking at you.
So you didn't even pick up what you said. So.
Oh, okay.
Epiglottis?
Yep.
Is that a valve?
I don't think so.
I don't know.
Now round 3 is the speed round, so this is like as quickly as possible. All these questions are worth 2 points, so this is like if you're gonna like want to have like a comeback, for instance, like if the current point standing is Dr. Chris has half a point, Dr. Michael has 3, and Dr. Cole has 5.5. So like this
need to come
like
back.
You can make the comeback here.
exactly, yeah. What is the body's primary source of energy?
I want to say ATP.
Think of a more general term.
Glucose.
Is it a macronutrient, Sean?
Next question is, how many chambers does the human heart have?
4.
Yep.
Don't call it a comeback.
Alright, next question is, which vitamin is known to help improve vision?
Vitamin K.
No.
What? It does though. It's right. It is.
You do be right.
What they have?
What?
E?
A.
Oh wow.
What?
A and K?
I just said A. Next question is, what is the medical term for high blood pressure?
Hypertension.
Yep. The last question in the speed round is, what does BMI stand for?
Body mass index.
That concludes third speed round. Points standing are Dr.
Yeah.
Chris with 4.5, Dr. Michael with 4, and Dr. Cole with 7.5. This is the round where you decide whether you want to give 1 point, 0 points, all your points. How many points are you guys willing to gamble?
3.5, huh?
Locking that number in?
Yeah.
All right. 4? All right.
I'm going all in.
Dr. Cole?
3.
So the question is, in the context of the upper cervical spine, how does the alar ligament contribute to limiting axial rotation, and what are the potential clinical consequences of an undiagnosed alar ligament injury in patients presenting with chronic headaches and neck pain?
So it's based on the anatomical relationship of where the ligament is located. On C2 behind the dens, so it provides support on the dens to C1, and that helps to limit and stabilize rotation of the neck. So if there's an injury to that ligament, they could present with maybe hypermobility, neck pain, swelling, things like that, headaches, migraines. So that would be something, you'd see maybe on like a car accident or some type of trauma, where it would be a good idea to get x-rays and do a thorough examination to rule out injuries like that. So I believe that answered the question.
The alar ligament, I want to say, is the one that's right on top of the C2, and it keeps the head on the spine, I believe. C1 and C2. And I would guess that undiagnosed alar ligament injury could put pressure on the brainstem or pull on the dura mater and cause headaches. Final answer.
How does the alar ligament contribute to limiting axial rotation, and what are the potential clinical outcomes of an undiagnosed alar ligament injury? So, what I'm thinking of is the alar ligament is what holds your dens on C1. So, think about this being C1, this is C2. Without the alar ligament, your C1 would be able to bounce around. It's not going to be able to rotate correctly on your dens. So that can lead to, one, a dens fracture, which is more severe than just headaches, but it can also cause neck pain. If C1 and C2 are just bouncing around, it can compress the vertebral basilar arteries on either side. And anytime you have arterial occlusion to the brain, that can cause headaches. As far as neck pain goes, so your nuchal ligament, which connects to the base of your occiput, that's going to go on stretch because there's no longer upper cervical stability. So I'm going to guess it leads to upper cervical instability, which could compromise the arteries, vertebral basilar artery, as well as impinge the nerve coming out of C2 of the IBF.
Dr. Michael and Dr. Chris have a punishment.
Well, thanks for watching, guys. Even though, Dr. Michael and I lost, so we have some punishment ahead of us. If you like these videos, let us know in the comments down below. Please like and subscribe for more information, and take care.
Doctors.